Would you say the fact that you've had your hand in different areas within dentistry has kept it exciting for you? Is that what's kept you passionate about dentistry?
Yeah, that's a good point, actually. Yeah, thanks for that. Because I suppose I like, I'm genuinely interested in lots of different things. And my challenge usually is, how do I not take on too much? So I'm a bit like that. But I did see the need to have variety in my career, or I call it color in my professional career. So, once, I told you we got into total quality management, right?
Yes.
It so happened that 2 years later, they introduced this thing called clinical governance, which, I can see you glazing over right now, right? But clinical governance is exactly the same as total quality management, if only people realized it. So we were well set, because we already literally got the Bible on clinical governance. We had a procedures manuals like this much, right? So I started teaching clinical governance and audit. So and the teaching side of me with the vocational trainees was brilliant, and that suited my personality and my character. So what I suppose what you've got to do is learn about yourself, find out where your strengths are, and see what you can do in dentistry that may go for that, or maybe, as I say, maybe doing crochet at a world-class level. I don't know, but using dentistry as your sort of vehicle to help you get there. Or maybe it's bringing up 6 kids or whatever. I don't know. But
In Toy Story, you also talk about Kaizen. How does that continue to happen in your life? So Kaizen being continuous improvement. How do you continuously improve? At the stage that you're at, and the experience that you've got. How does that continue to happen?
Well, I think it's being able to be honest. I try to be honest with myself. When I make a mistake, I'm sure I make mistakes and I'm not honest with myself, and but I try to be honest with myself. When I make a mistake, I reflect on it. And I think it's about, actually, you brought up a really good point here, Arnold. This is really good. Dentists get hung up on perfection.
Yeah.
Right? As a general rule, we're all perfectionists. And you will never, ever, ever achieve perfection. So if you're not going to be happy until you achieve perfection, you will be continually beating yourself up. And we do that a lot. And sometimes it can be extreme. 4 people in my year of 50 have committed suicide. Okay. And a few have been alcoholic and all that sort of stuff. So we beat ourselves up. So where does Kaizen or continuous improvement come in? It really means that you're never going to achieve perfection. What you need to enjoy is the journey towards perfection.
Yeah.
So if you're willing to accept, A, you've made some mistakes, and B, a small change is better than no change. So it may not be perfection, but if you can improve things by 1%, and you try to improve lots of things by 1% every year, things get a lot better. And that's actually how change happens. Real change happens.
Yeah.
It's by lots and lots of little bits of improvement. And it ties in then with a dentist enjoying the journey to perfection, rather than thinking, I'm not going to enjoy it till I get to perfection, because you never get there.
And tied into this as well, as a dentist, you'll get, let's say, 30 patients in one day, and there'll be the one patient where it didn't go right. But the 49, they went well. They were excited about the treatment. They were very happy, but you hung up on this one patient or this one treatment.
Yeah.
How would you say you overcome that, if you find yourself always going back to the one?
That's such a good point. You brought up, I'm shivering at this point. You brought this up because I can remember in my first couple of years when I was working with Bob Borrell, I used to walk to work because I only lived down the road. And when I walked home, I'd be going through my mind about that mistake I'd made on that one patient.
Yeah.
And it probably was 50 patients in them days, mate. But anyway, that one or two, or probably 5 out of 50. And by the time I got home, I was in my head, I said, now hang on a minute, get this in perspective. There were 45 things you did really well there, right? That you do have to work on yourself. And one of the great things about the Panky thing, I told you, we talk about values and things like that.
Yes.
Well, Panky was a great communicator, and he would sort of give you a perspective. And one of the things he said is, if you want to be happy as a dentist, and I would say that was prosperous, you got to know your patient.
Yeah.
You got to know your work. You've got to know yourself. Right? And after that, you've got to apply your knowledge.
Okay.
So know your patient, that's pretty obvious. Know your work, we're all into doing courses. Knowing yourself, that's hard. And a mentor can be helpful there, being able to reflect. If you want to get down to the nitty-gritty, doing an audit on your work. Actually, how good is it? One of the great joys I had of my life was as through the 90s, when I was getting out of the financial problems that I had, I took on a partner, Nilesh Shah, who'd been on my vocational training scheme, superb dentist, and we totally got into this quality management thing and all that sort of stuff. And we used to look at each other's work and give ourselves an honest appraisal, and not many, and not feel defensive about it. I mean, I felt a bit defensive because he's such a good dentist, but it made me get some loops and things anyway, and stuff like that. But you learn from that, and networking with people. So how do we get to that? So how do you avoid, I suppose, focusing on the negative? That's really what you're saying?
Yeah, the one thing that goes wrong.
It's something you'll have to work at, and accept, you're not perfect. Even though you probably, to try and get there, you've had the perfect A levels, the perfect interview, the perfect 12 months off, going around the world to get the perfect CV or whatever it is. But you're not perfect. You're dealing with human beings, for God's sake. So I have a saying, when I do mentoring for our diploma in Invisalign, I say, well, look, somebody's wringing their hands because they've made a mistake, and I said, look, nobody died, right? It's only Invisalign. So we're not on, in intensive care or anything like that. For God's sake.
Let's talk Invisalign. Because
okay.
I feel like Invisalign is the one thing that's really taken dentistry by storm recently. Patients, the general public know about it. Students are seeing qualified dentists doing Invisalign. It's become this force within dentistry. How did you get into Invisalign, and what would you say to not aspiring dentists, to newly qualified dentists who want to explore Invisalign as a treatment?
One of the great things about Bristol, when I went through Bristol, was I had 3 years of orthodontic training in undergraduate. So I actually saw lots of patients all the way through. Now, in those days, it was just removable appliances and functional appliances, but we got really, really well taught, Chris Stevens and David Brown. So as soon as I got into practice, I wanted to make orthodontics part of my practice. So I was treating kids with removable appliances. Fixed wire appliances were very, very challenging in those days, because you had to literally bend every wire. You had to put a band around every tooth and put a bracket on it, and you had to know how to bend the wire and things like that. You needed years and years and years of training to do that. It clearly was a specialist thing. But you could do removable braces, and when no braces were available other than that, the patients are happy. I could not bend a wire to save my life. I literally can't, right? So then in the late 90s, early 2000s, they brought out this system called straight wire orthodontics, which is what we have today, which is where the intelligence is in the bracket. So if you put the bracket on in the right place, the wire's got an arch form. You don't have to bend it. It just moves the teeth to the right place. So I got onto a straight wire course at University of Sheffield. And so I started to do removable braces and fixed braces, straight wire braces on kids. So that sort of, and this is one of the nice things about general practice, because, I was doing loads of that sort of stuff. Nilesh, my partner, he loved blood and things. He was a superb surgeon. He got into implants, and you can have your own little area. I wasn't doing it all day every day, but maybe 20% of my life was doing ortho. 20% of his life is doing implants. It's nice. It gives you variety. And then in 2000, I think Invisalign gets launched on the UK market, and it's this little bit of plastic. And honestly, I looked at that. I said, that's a load of rubbish. Not only that, it comes from America, so it must be rubbish. Okay. Because every few years or every year or so nowadays, you see some new product is going to change the world. You buy loads of that product. It's absolutely crap. And you've got loads of it in the cupboard and you can't use it anymore. In fact, you're putting all the problems right 2 years, 3 years down the line, and you can't see the reps nowhere to be seen, right? So I'm cautious about what I take on.
Were they the only ones presenting clear aligners to the UK market at that time?
Some dentists were making their own by, casting a model and cutting it up and moving the teeth on the model. And they were doing a little bit of that themselves. It was a recognized technique. Invisalign were the first to come with a digital model system. But in that time, it still was an ordinary aligner system. It was just an ordinary plastic. Okay. Anyway, in 2007, it's still going. So it's not just a flash in the pan. My private practice was thriving. I had all these healthy patients who were paying me a monthly fee, right? And they needed nothing doing. And I was getting a bit bored, frankly. And my mate went on the Invisalign course and he said, Andy, you'd really love this digital program called the ClinCheck. And so I went on the course because I had a bit of free time. And I really like this digital thing called the ClinCheck. And I liked it because as a restorative dentist, I like to see things ahead of time. I like the wax up and things like that. And so this was effectively my orthodontic wax up, whereas traditionally with fixed braces, you make loads of room by taking teeth out. You stick a load of brackets and wires on and you sort of shut your eyes for 6 weeks and see what happens. And then you work it out, you see. You don't know exactly where you're going to finish at the end of it. So we could do this thing called a ClinCheck, this digital wax up. And the other thing I really liked about it,
just for people that don't know, this time lapse that shows you how the teeth straighten out before you.
I'm sorry, yes, a 3D treatment plan, which takes the original model and they work out where all the stages are to give you the finished result. And it's like a movie, basically. So you can see that ahead of time. And the other thing I really liked about it is I could show the patients. And I'd started doing research at that point on consent. Consent is a big part of my world. And because we were getting, we as a profession were getting loads of problems with the General Dental Council and lawyers and stuff because we weren't properly consenting patients. So this appealed to me. And so anyway, I went to do the course, came back, I started offering it to patients. But at that time, Invisalign was quite an ordinary system. It was like the plastic they used then was like everybody's plastic and aligners they have today, right? And all the other systems. So you always had to sort of apologize for it. They're not going to be super straight, but they're going to be better than they are. If you want them super straight, you have wires. And they didn't want wires. I'd be happy with it's good enough. And a lot of patients think it's good enough. It doesn't have to be perfect. For what we think is perfect. Anyway, it started to grow and grow and grow. So the first year I did 20 cases. The next year I did 40 cases. The next year I've done 70 cases. And they asked me to become a speaker. And at that time as well, they launched what we know as the Invisalign of today. They basically spent something like $500 million on research. And we have this incredible plastic material. They developed the 3D treatment planning, the predictability. There's all sorts of other things that go with it. And they continue to invest $150 million a year in their research. That's more than any other orthodontic companies even worth. And they now have developed a system which, can pretty much treat everything. So that got me excited. And I won't give you one little bit of Toy Story was I broke my arm. I had 9 weeks off practice and I realized it's time for me to sell my practice. I was 50. And so I focused on lots of things like education stuff, but the clinical work I wanted to do was Invisalign. So I basically went down to 1 or 2 days a week Invisalign. And I've carried on with it like that. And the reason I'm still there is they keep investing in the system. It gets better and better and better. And what it's done is to me, it's democratized orthodontics. So that there's so much, especially with the new, I don't know whether you're familiar, but if you want to get into Invisalign now, you have to go and do an Invisalign Go course first, right? Which is a limited form of Invisalign. It's the most predictable movements, and it doesn't allow you really to do anything stupid.
Yeah.
And that's a great place to start, okay? Even though you might want to go and change the world with Invisalign, you've got to start somewhere, right?
Yeah.
And it's almost democratized it, because all that intelligence and experience that the really good orthodontists understand their biomechanics, they're building it into the algorithms. So you can ask it to do something stupid, and if you want it to, it will. But if you follow the rules and you get the support that is there as well, there's an incredible amount of support around the Invisalign system. Yeah. You know, I helped set up the forum for the Invisalign Go, for instance. You got literally an expert in the room with you, because they'll answer it within 24 hours. All of that, you can't really do anything stupid with it. And what we discovered now when we teach the diploma, we teach the only postgraduate diploma in effectively Invisalign in the world, is that when we sit down with it as a small group and look at everybody's ClinChecks, you're looking at maybe 10 or 12 treatment plans, whole treatments in 2 hours, because the ClinCheck is showing you from the start to finish. Whereas when I did my fixed training, in 2 years, I might have seen 10 cases. Yeah. So so it's democratized orthodontics. It can be abused, and it can be misunderstood. It can do some stupid things if you ask it to, if you don't follow the rules. But who better to do the orthodontics than the general dental practitioner? For the vast majority, right? There's still crazy cases out there that you need a lot of experience for, and you can get that. But there's so much simple orthodontics to be done that would really benefit the patient. Yeah. You know, never mind appearance, get the occlusion better, get them easier to clean, stop it getting worse, if nothing else, because there's only three definites in life, Arnold. So this is another lesson from Toy Story. Yeah. Death, taxes, crowding. But it's true, right? Yeah. And so, you know, if you see a patient who's like a car crash at the age of 50 because their canines out everywhere and their teeth are worn down, they weren't a car crash at the age of 25.
That's true.
Yeah.
That's true.
So now you can intervene now and get into it much more quickly. So
would you say foundation dentists would have to wait a couple of years before they decide to pursue the course and become a provider? What would you say in terms of when someone can feel ready to make that step?
Okay, well, that's a good point, actually. I think always every foundation dentist, I think, should understand that you have got to get good at the basics. And whether that be simple restorative, but really it's a lot about getting good at connecting with patients. And you have to, you know, some of people are more talented that way than others, but wherever you are on that spectrum, if you can't relate well to the patients and they can learn to trust you, okay, then you're not going to get anywhere. So that's a lot about experience. You just got to go all the way through that and see lots of patients. Yeah. If you think, well, I really like the idea of orthodontics, then that's great as well. And so maybe as you're sort of getting through that level of that amount of experience that you have simply seeing patients, you know, being able to do a composite with your eyes shut and doing really good comprehensive exams and all that sort of stuff, that might be a second year after qualifying, it might be. But the other thing then, you need to be in a practice where you can be doing Invisalign.
Okay, because, so what is that, a practice where you can be, what does that look like?
Well, I think that, and the reason for that is you can only learn Invisalign by doing cases. It's a clinical skill, right? So what does that sort of practice look like? Well, it'll be a practice that is used to having been able to take money privately, that patients have an element of trust in the practice because they're not really buying Invisalign, they're buying you.
Yeah.
So, you've got to be in a place where the practice is sort of open to doing Invisalign. They're willing to invest in it. You need to train your team in it. You need to have patients who are likely to, a certain number of patients to say yes as well. And so that sort of, so probably if you're new to dentistry, you're only in your first, second, third year, you have to be in the right place for that. Because if you don't own the practice, or you've not been there as an associate for quite a while with your own patient base, that you can just go to and they already love you, and so I'll do whatever you say. It's going to be hard, and you can go and do the course, but if you're not doing 2 or 3 cases in the first couple of months and really looking to get 10 cases in the first year, you've wasted your money. And I wouldn't want to go to anybody who's doing like 1 Invisalign case a year, just like I wouldn't want to go to an implant dentist who's doing 1 implant a year.
That's true.
Yeah. So I don't know, what's your experience with Invisalign then?
So I saw my supervisor during my foundation year. He was using Invisalign, and that's when my eyes really opened to it. Went on a course. Dr. Adrian was
Cunningham. Yeah.
Yes. And Afan was actually learning to be a teacher on that same course as well.
Yeah.
It did that, and got quite a few cases within my first year. I think I got about 10 to 12 cases.
Perfect.
And that really got me into the groove with it. And now I've actually been getting a lot of referrals. So at the moment, it looks like it's a lot of people that work at the salon that are coming to Invisalign with me, because the referrals are now getting out there. And recently, I was actually awarded as the top provider in my area. So it's
fantastic.
Really gone from strength to strength with Invisalign.
People would think we scripted this, and we genuinely didn't, did we? There you go.
Yeah.
So you were in a practice where they're already doing Invisalign. That helped, right?
There were 2 providers, but they weren't really doing cases.
Right.
So it's when I went there after my foundation year, that's when the cases started really coming in, and we've become one of the practices for Invisalign in Preston.
Yeah, brilliant.
The iTero was a game changer, though. I don't know how I was doing it without the scanner before.
Right. Well, okay, so I bought a scanner for my 60th birthday. Because my NHS pension came up, you get this lump sum, and loads of my friends had gone and bought the big Merc at last or something like that. I thought, I don't want a Merc, I'll have a scanner instead. And it's brilliant, right? It really is. So there you go.
I don't want to keep you too much longer, but I really want to say that this has been really refreshing to see somebody with so much experience who has such a positive outlook on dentistry, because sometimes the voices that you hear is people saying how bad dentistry is getting.
Right.
So it's refreshing when individuals like yourself are actually optimistic and enjoying dentistry. So thank you.
Absolutely.
Thank
you. You know what? When I went to the Pank Institute in 1982, I was 23, 24. I was the youngest there by far. There was all these old gits there, right? And when I say old, I mean 40, right? And light cured composites were literally just coming out.
Yeah.
So we didn't have them in the UK at that time. And they were showing us what you could do with light cured composites. And this old guy of 40 turned to me and said, "Do you know what? This is a great time to start dentistry." And I found myself the other year, and it was the Invisalign thing come out. Some other wonderful thing come out with Invisalign. And I turned to my colleague and I said, "Do you know what? This is a great time to start dentistry." I thought, oh my God, it's always a great time to start dentistry.
Yeah.
It is. If you listen to the naysayers, right, the golden years of dentistry were always 5 years before they qualified. Now, whether they qualified in 1980 or 1990 or 2000 or 2010 or 2020, it was always 5 years before they qualified. What a load of rubbish. It really is what you make of it. And you have so many different aspects that if you go to general practice, so many different aspects that you get into.
Yeah.
Whether it's clinical, business, teamwork, or just becoming the world's best crocheter, whatever it is. It's just fantastic.
Final question.
Okay.
What is dentistry to you? If you're to summarize it, what does it mean to you?
Okay, so dentistry gives me is an amazing vehicle for my personal and professional development, to really work on myself and express myself in so many parts of myself. I'm able to express it through dentistry, and I've learned things of myself and extended myself in that way. It's not my whole life. I know I have other parts of my life, but and it's financed to the rest of my life as well, to be fair. Yes. So it's this constant challenge, which I find great, and it's this ability to a large extent, really, really control what you do, take control of what you do, and chart your way through the challenges, whether they are from the outside, like COVID, or whether they're from the inside because I was stupid with money, or whatever it is. And I think we're in a great profession, and people like you, Arnold, out there trying to bring people together and network like you do, and using the modern social media and all that stuff is just fantastic. So you play such an important part to help people bring on and be the best of themselves, whatever that may be. It's fantastic.
No, thank you for that. Thank you for those words. I want to say I've absolutely enjoyed this discussion today. It's been refreshing. It's been inspiring. I feel rejuvenated to go back out there and treat my patients. Guys, make sure to contact Dr. Andy Tsoy through his Instagram. I'm going to put his details down below. If you want to ask further questions or just to see and keep up to date with what he's doing, I know I will be. And make sure to subscribe as well to the YouTube channel. Follow the page. We're going to be bringing out more content like this for you who's thinking of getting into dental school, for you who wants to get into dentistry and really be exploring all that there is within dentistry. And thank you for watching, and we'll see you guys at the next one. Thank you, Dr. Andy Tsoy.
It's a real pleasure. Thank you.